Okay, guys, let's talk about healing and closure. Healing, we confuse healing with closure. Healing is termed as primary intention, secondary intention healing. That's the most common questions you will face in your exam. And tertiary intention healing. Now, closure is when you close the wound, either you close, either you don't close. If you close and if you don't close, these are two different cases. If you close, you can close it immediately after the wound or operation. Immediately after the wound or OT. That's a primary closure. You can use suture, staple, or any other method you like. Any other method you like, or whatever that is appropriate, you use that. Immediately after OT or immediately after the injury, that's a primary closure. That's a primary closure. That's a primary closure. Healing, that's a different thing. That's a closure with suture or staple. If you wait for some days, like 3 to 4 days after the wound or OT, that's a delayed primary closure. Delayed primary closure. If you wait beyond 4 days, if you wait beyond 4, 5 days after the wound or after the OT, that's a secondary closure. Secondary closure with anything you like. Suture, you can give a stitch or staple or anything. The problem is with that, you confuse secondary closure with secondary intention healing. Don't do that. These are two different things. And don't close is don't close. You keep the wound open. You keep the wound open and do regular dressing. Be very careful about answering these things. Secondary closure is not secondary intention healing. Secondary closure is not secondary intention healing. Primary intention healing is primary closure. If you primarily close a wound, if you primarily close a wound immediately after OT, that heals by primary intention. If you don't close the wound, you keep it open and you do dressing and it heals itself. It heals itself. That's a secondary intention healing. That means don't close is a secondary intention healing. And delayed primary closure and secondary closure. These are tertiary intention healing. Tertiary intention healing. Don't confuse it, guys. These are the questions you will be asked. Two type of questions. When will you close? When will you close? And another question, what kind of healing happens? What kind of healing happens? Now you know, if you don't close, if you don't close, it heals by itself. That's a secondary intention healing. Secondary intention healing happens in, they will ask you, a diabetic patient with abscess. Diabetic patient with abscess or any abscess. We don't close. We don't close that. We don't close that. And that heals by secondary intention. Or any abscess, perianal abscess, or any abscess. We don't close any abscess. So it heals by secondary intention and we don't close that. We don't close that. Now, this is specific for abscess. Specific. We never close an abscess. Now, we have a problem with dirty wound. What do we do? Dirty wound or diabetic patient with a wound. Diabetic patient with an wound. Diabetic patient with an abscess and diabetic patient with an wound are not the same thing. Diabetic patient with an abscess or any patient with an abscess, we don't close it. We don't close it. But diabetic patient with an wound, we close it. Or a dirty wound, we close it. When do we close it? We delay. We do a delayed closure. Dirty wound. We get confused with dirty wound. Let me give you some examples. Examples are garden fork, stab, around, anus, or stab with any kind of sharp nail. These are dirty instruments. They have a lot of bacteria in it. That's why we wait for some time and we close it directly. They don't ask about what kind of healing it undergoes. It undergoes tertiary intention healing. Tertiary intention. That's not secondary intention healing. That's a tertiary intention healing, guys. That's a tertiary intention healing. Now, normal wound, we all know. We close it primarily. Normal, fresh wound. So we are not talking about that. We are talking about now another case we don't close. Lacerations. Lacerations. We don't close lacerations. This is not a stab or ages are not defined. We cannot approximate like bike accident. Okay, lacerations, we don't close it. It heals by secondary intention. It heals by secondary intention. Remember from our class, do not close. Do not close if diabetic. You close after 3 to 4 or 4 to 5 days. That is a delayed closure. That is in case of a wound. We told you in class. Secondary intention, abscess. Abscess. Then dirty wound, shark bite, RTA, stabbed with garden fork, indurated swelling, discoloration of skin, contaminated. What do? You give antibiotics and you do dressing. Delayed closure. If it's a stab, secondary intention. If it's a laceration, you will find something like wound cannot be approximated. What do? We do graft and flap. That's a different thing. Then any operation, pressure sore, infection, necrotic tissue, you debride, you dress, and you do not close it. do not close, and it heals by secondary intention. Okay, guys, thank you.